You're watching POCN News, brought to you by HD Live, the streaming news service from Health Day.
Thanks for joining us. I'm Mabel Zhang. According to a new study, about 2 million U.S. adults reported purchasing medication outside the country to save money. Those who bought medicine from outside the United States were more likely to be older than 64, from Hispanic or immigrant populations, to have higher educational attainment, to have lower family income, and to lack insurance. In 2018, 27.5% of older adults reported falling at least once in the previous year, with 10.2% reporting an injury from a fall, according to new research. The authors note that reducing fall risk and fall-related injuries in older adults is essential to keep them living independently and injury-free. Long-term intake of added sugar and sugar-sweetened beverages is associated with higher pericardial adipose tissue, visceral adipose tissue, and subcutaneous adipose tissue volumes, according to a study. These fat deposits are linked to a greater risk for heart disease and diabetes. 3 major medical groups are urging Americans to take COVID-19 protective measures seriously. In an open letter to the American public, the American Medical Association, the American Hospital Association, and the American Nurses Association wrote, "We are urging the American public to take the simple steps we know will help stop the spread of the virus: wearing a face mask, maintaining physical distance, and washing hands." In an HD Live interview, we spoke with Dr. Robert Brook, professor of medicine at UCLA and director of the Healthcare Services Program for the RAND Corporation, to learn more about how healthcare workers can stress the importance of face masks and taking these precautions to patients. Here's what he had to say.
It's the way you say it. 3 things motivate people. 3 different people are motivated. Some are motivated by analytics, which is more information, more science. I'll give you a paper and you read it and then we'll talk about it. Some are motivated because of altruism. They want to help somebody else. Do this for somebody else, your mother, your father, your child. And some are voted because they're autocratic. Do this because they want to be in control. So we need messaging. We need communications. We need people in the communication school to put messages all over the buses, all over the institutions that use all 3 ways of communicating. So those people that respond to one will increase their compliance with all of these recommendations, and those that respond to another will do the same thing. We're not all the same, and that's the beauty of us, but that's why it makes it difficult to implement this kind of a policy.
Lastly, a new study finds a significant increase in the use of complementary and alternative medicine for people with multiple sclerosis. Here's more on that topic.
More people with multiple sclerosis are turning to complementary and alternative medicine, according to a new study. The research published in the journal Multiple Sclerosis and Related Disorders found significant increases in the use of supplements, exercise, and mind-body therapies over nearly 2 decades. Investigators surveyed more than 1,000 MS patients in Oregon and Southwest Washington in 2018. 81% of participants reported using vitamins, minerals, or herbs. 39% said they used mind-body therapies such as mindfulness and massage. 41% used a specific diet, and 81% used exercise. These numbers showed double-digit increases from a similar survey conducted in 2001. In 2018, respondents were also 9 times more likely to discuss complementary and alternative medicine use with a neurologist. The authors say CAM use overall has increased, and people with MS are communicating more with their MS providers about their CAM use. Both people with MS and providers need high-quality evidence-based research to guide appropriate education regarding both safety and efficacy when CAM is in the MS treatment strategy.
Thanks for joining us for HD Live, the streaming news service from Health Day. I'm Mabel Zhang.